I'm Dr. John Fogarty. I'm Dean of the Florida State University College of Medicine. It's my pleasure to welcome you here in front of this unique facility with a unique mission. We're the first new medical school in the United States in 20 years. We were established in the year 2000, and so far we've had over 910 graduates over our first 11 classes. In our first decade, we were really focusing on our educational mission. We have a unique educational model where we have students spend their first 2 years in Tallahassee, and then they go to one of 6 regional campuses around the state where they're really focusing in the ambulatory environment, learning to be exemplary physicians that are going to be focusing on their communities. In the last 5 to 8 years, we've really been focusing on our research mission. It's really important for medical schools not only to train the next generation of physicians, but also to generate new knowledge. And we're very proud of the expansion of our research mission over our last 10 years. It's not only allowed us to expand new knowledge, but to potentially develop products that are available for commercialization and on the market. We have a number of different researchers that are taking these products and building and growing their own companies and commercializing. For example, Dr. James Olchese, an associate professor in our Department of Biomedical Sciences, has been very interested in biorhythms and sleep. And he's been really particularly working with pregnant women and developing drugs that are potentially available that may be able to influence the onset of labor and how that all works. Let's hear from James.
The idea of treating preterm labor has, of course, been around for a long time, and there are strategies that have been employed, but a lot of these treatments have side effects, which are quite serious for both the mother and in some cases for the child. Our idea of treating preterm labor does not involve any kind of a pharmacological approach. The woman's body tends to go into labor and give birth naturally during the nighttime. So our patent involves using blue light in the form of a light-emitting device. Currently we're using a prototype, which is a goggle. Ultimately we want to move to a sleep mask device with LEDs embedded in it that will become active during the course of the nighttime, provide blue light to the eyes of the woman and suppress contractions. The outcomes could be tremendous because this would have essentially no side effects. It's very cost-effective, comfortable, and could save not only billions of dollars in healthcare costs, but also millions of lives.
Let me now tell you about another one of our great researchers, Pradeep Bide, a professor in biomedical sciences, who's also the Jim and Betty Ann Rogers Chair in Biomedical Sciences. He's also the director of our Brain Repair Institute. He's doing some wonderful work on ADHD, developing some non-addictive drugs that can help in this very, very common disorder and problem for our children of today. Let's hear it from Pradeep.
So what we have been working here at FSU is development of a new drug for the treatment of ADHD. Currently, the standard treatment for ADHD, the class of medication is called stimulant medications. For example, Ritalin, Adderall, etc. Although they are very effective, there is a very serious side effect of using these medications, and that is drug abuse or dependence. And the drug addiction concern about stimulant medications is so high that the DEA and FDA place these treatments or medications in the same category as a number of addictive drugs such as methamphetamine or cocaine. So the new drug that Avekshan is working on, it does not have the abuse liability associated with the standard ADHD treatments available today. Therefore, it is likely to be more acceptable. It's likely to reach people who need the drug, both children and adults. The goal of Avekshan is to develop this drug, bring it to market, commercialize it, and make it available to people who really need it, who currently do not take the medications because of the various side effects.
Okay, so there you have it. One of the stories I like to tell is that when we filled out this biomedical science building, which is just to the right of me, we originally, when we first moved into it, we had a lot of space in there. We've now grown into that building, and so the chair of that biomedical science department asked me, so what's our next step? Our next step is actually to build another research building across the street from the College of Medicine so we continue to expand, grow, bring spectacular investigators and researchers here. The advantages for us is that we continue to grow the knowledge and build the science of the future, but also for every dollar we spend and every dollar we bring in from the federal government, from state governments, and from other funding agencies, it also has a huge economic benefit in terms of the people that we bring in here, the products that we develop, and the programs that we have here on campus. We're very, very excited about what we're doing. We're very proud that the College of Medicine has been a part of the first ever Discovery on Parade. I hope you enjoy the rest of your evening.